Okay, I'm going to go ahead and get us started. Good afternoon. This is Elizabeth Lauer-Bash at the Center for Law and Social Policy, or CLASP. And thank you for joining us today to talk about the new provisions in the legislation that has been passed by Congress that will provide some benefits to families and individuals who are impacted by this economic moment that we're finding ourselves in, and really look at sort of how it intersects with the benefit programs that have been around for a long time and make sure we understand how they interact. I will acknowledge that this is still a little bit preliminary. Certainly the IRS has been changing its answers on some of the questions as late as last night, so I just updated the slides to reflect that. And certainly if we get questions that we're not able to answer now, we'll take them down and try to provide information as we get clarifications. So, okay, let's see if I can, sorry, I don't think my screen is doing what I think it is. There we go. Okay, sorry about that. Technical challenges always. So we're going to go over, I'll talk about the economic impact payment, otherwise known as the stimulus refund. My colleague Punita Gupta will discuss the Emergency Paid Sick Leave and Emergency Family and Medical Leave Act expansion provisions. And then Junie Conti from the National Employment Law Project was kind enough to join us to talk about the unemployment insurance provisions. We'll talk a little first about just what all the new programs are, and then we'll loop back to talk a bit more about the implications for the existing benefit programs and answer your questions. Whoop. So the economic impact rebate I get to talk about, and I'm lucky because I think this is the most straightforward of the three. It provides $1,200 per qualifying adult, and that's people who are filing taxes for themselves and are not claimed as a dependent by anyone else, plus an additional $500 per child under 17. And one of the things that we were disappointed about how this was enacted is that you do have to have a Social Security number to qualify. And in the case of married couples, both have to have a Social Security number. Even if only one of them files with an individual taxpayer ID number, neither of them will receive it, with the exception of military spouses. As I said, if you can be claimed as a dependent by someone else, you are not eligible for it. And the IRS will base this on your 2019 tax return if that has been filed. But if it hasn't been filed, they'll look at your 2018 return. Although probably not of great impact to the audience on this call, I will flag that the benefits do phase out at higher income levels. This is the distribution. But it is important to note that the full benefit is available starting at 0 income. Earlier versions of this would have denied the benefit to people with very low incomes. This was something that we fought really hard on in the last bill and did win, but because there was so much media coverage of the original proposals, I've definitely heard a lot of confusion out there. So yes, people who do not have income, who do not have earned income, are eligible for this payment. How do you get it? If you filed your tax return for 2018 or 2019, you'll get it automatically. The news that I had to go online and fix this morning is that the IRS is now saying that Social Security recipients will also receive the payments automatically, even if they don't file the return, because the federal government, of course, knows who's getting Social Security benefits and has a way to distribute payments to them. So it makes sense and was in fact required by statute that the federal government would do this. I will flag this does not at this moment seem to apply to any other benefits besides Social Security. So it does not appear to apply to SSI. It doesn't apply to TANF cash assistance recipients. So we really do need to get the word out to people that they have to file in order to get the benefit. The IRS website will, they promise soon, have information on how to file a minimal return in order to qualify for this. People can also go ahead and file through the existing free tax preparation services that are available online through the IRS website. I have been hearing that if you really have zero income, it rejects that. So you do need to report some income, even if it's just like $1 of interest income, in order to make it go through. But more to come as we learn more about that. This advance payment option is available through 2020. July 15th is now the deadline for filing your taxes if you're required to file a return. But if you're not required to file a return, you can request this at any point in the year. After December 31st, you'd have to get it by filing your 2020 taxes in 2021. The IRS says that the distribution will begin in the next 3 weeks. We don't exactly know what that will look like. If you did file your taxes and provide an account for direct deposit, it will be automatically paid. Again, the IRS says there'll be some way to add direct deposit information if you haven't submitted that. That also includes if people got a refund anticipation credit or refund anticipation loan and the actual refund went to H&R Block or someone like that, then they'd have to update the information so they could actually get the direct deposit. And if they don't have any information on direct deposit, the IRS will mail checks. It does sound like that will take longer. And as noted, if you just don't do anything this year but file taxes next year, it will show up as a credit on your return. So just really briefly, this one's interactions with other programs are relatively simple. It is not counted as income for means-tested benefits that are at all federally funded. And similarly, it is disregarded as an asset for 12 months. This is how EITC refunds are treated. All the systems should be used to dealing with this, but it is worth checking to make sure that's happening correctly. The statute does say these refunds can't be intercepted for past due taxes or student loans or unemployment overpayments, but it does look like they can be intercepted for child support payments owed. So that may be something worth looking into. In some cases, child support intercepted means that it's going to the custodial parent, but in other cases, states do still keep child support to repay the state for benefits that have been granted. And in that case, we'd have some real concerns. So that's the very quick version. And with that, I'm going to hand this over to Pranita so that she can talk about the other provisions.
Thanks so much, Elizabeth. So yes, in response to this historic public health and economic emergency, the original version of the Families First Coronavirus Response Act was a far-reaching bill that would have created a permanent paid sick days and paid family medical leave program that so many workers with low incomes urgently need. This legislation would have covered most workers in the US. And as many of you know, paid sick days and paid family medical leave are critical supports that help keep workers with low wages connected to work when a critical health crisis or need arises. No one really should have to make the impossible decision between caring for their own health or the health of a loved one and their economic security. However, the version of the Families First Coronavirus Response Act that was signed into law was a stripped down version of the original bill, and the permanent programs were removed, and only the emergency paid sick leave and a narrow emergency paid family leave provision were included, thereby leaving millions of low-wage workers out of these critical programs during this national pandemic. The CARES Act only made some minor changes to these programs. But altogether, these bills are an important first step since it's the first time Congress has required federal paid leave for private sector workers. They create new rights for at least 50 million workers immediately in both the private and public sector. So the first piece, which is the emergency paid sick leave provision, the Act requires workers to be provided up to 10 days of paid sick leave for the coronavirus pandemic, which started yesterday and goes on until December 31st, 2020. And workers can use it for the following reasons. If they're subject to a mandated quarantine or isolation order, if they're experiencing symptoms of COVID-19 and are seeking a medical diagnosis, if they're caring for somebody who's subject to a quarantine isolation order, if they're caring for their child whose school or place of care is closed or whose childcare provider is unavailable, or if they're experiencing a substantially similar condition that is to be specified by the Departments of Health and Human Services, Department of Labor, and Treasury. Next slide, please. Great, thank you. When a worker needs to take paid sick days, the Act provides full wage replacement if the worker takes it for their own care, but limits it to 2/3 wage replacement if the employee is caring for another person or child. As you know, this reduced wage can really make it difficult for workers who only make the minimum wage from being able to afford to take this leave. And I do want to clarify that these are regular wages in a worker's paycheck. So it's not some additional form of income or payment. And then once the way it will work is employers will pay their employees and can get reimbursed by the federal government through tax credits. Next slide, please. The emergency paid sick days provision covers local, state, and some federal employees, self-employed workers, and private sector workers for employers with less than 500 employees. It also covers full-time and part-time workers. However, it excludes workers who work for an employer with 500 or more employees. This includes large restaurants and retail establishments. It also allows employers of healthcare providers and emergency responders to opt out, and further allows the US Department of Labor to exempt these workers who are really at the front lines of the pandemic. DOL can also exempt private employers with less than 50 employees from providing leave to care for a child whose school or place of care is closed or whose childcare provider is unavailable if it harms their business. Next slide, please. The emergency paid family medical leave expansion. So this act temporarily provides up to 12 weeks of paid family medical leave during this health emergency. However, this expansion is very limited and will only allow workers to use paid family and medical leave for one specific purpose: if they are unable to work or telework because they're caring for a child under 18 whose school or place of care is closed or whose childcare provider is unavailable. The first 10 days of leave may be unpaid, although employees may be eligible for paid sick leave during this time. After 10 days, employees may receive 2/3 of their regular wages for the remaining 10 weeks. However, again, this may create a financial hardship for the lowest wage earners. Like the paid sick days provision, employers pay employees and can be reimbursed by the federal government. This provision also excludes employers with 500 or more employees and the majority of federal employees. It also allows the Department of Labor to exempt small businesses and certain healthcare providers and emergency responders claiming hardship. It also doesn't guarantee job protection for employers with less than 25 employees, meaning these workers who work for those employers can lose their job by taking this leave. I also want to make a note that neither program, neither the emergency paid sick days or the emergency paid family medical leave program, will exempt existing state and local paid sick days and paid family medical leave programs. The regulations for these two programs were just published today, and we will have more information about additional guidance as this program is implemented over the next few days and weeks. Thank you.
Okay, I am about to hand it over to Judy Conti to talk about the unemployment provisions. But Pranita, before I do, could you just say a little more about how the paid sick days works for people who are self-employed?
Sure. For workers who are self-employed, they will be able to, basically, they will be able to take it and they will get reimbursed through tax credits by the federal government. And there are some provisions in being able to advance some of these tax credits.
Okay, thank you. Let me get Judy's slides too. Okay.
Great. Thanks, Elizabeth, and hi, everybody. Before I start, I just want to let you know, if you hear me coughing, I swear to you, I am not coming down with anything. It is seasonal allergies. So no worries there. I appreciate the opportunity to talk to everybody. Before I get started on the substance, I want to give everybody a heads up. Congress put together 3 new programs that are similarly titled and similarly acronymed. And even for those of us, the hardcore UI geeks, it gets confusing after a while. So if you find yourself tripping over names or acronyms, don't worry about it. You're not alone in that. I think the important thing to take from this is that these UI packages are going to cover a broad swath of workers who have lost wages or are losing jobs, much more so than they usually would, and that the state UI agencies are there once they get this up and running to help people figure out which program is right for them. The workers that you're advising don't have to know what program they're necessarily covered under when they are applying. That is the state UI agency's responsibility to do. So just put them at ease about that. Next slide. Just quickly to let you know that the Families First bill, the second bill that Congress passed, included $1 billion for state UI administration to help them ramp up for all of the claims they're going to be dealing with. And there is additional admin money in the CARES Act as well. You're going to be hearing lots of stories about how the agencies are overwhelmed, and they will be. They have not been adequately funded under the best of times. They are short-staffed, and they are trying to staff up quickly. And it's going to take a few weeks for these programs to get up and running. And phones are going to be jammed, and it's going to be hard to get through and get answers. And there's no good advice that I can give anybody about that, other than to say that we really do know that the state agencies are doing the best they can under really bad circumstances. And we know that workers are scared and worried about their finances. And it's going to have to be some time where we give the state agencies a little bit of space to do the work that they need to do, and try to be patient with them. The Department of Labor is, we believe, truly on top of this with the state agencies. And NELP is monitoring this through our very active UI listserv to make sure that if there is any state agency we feel like is dragging their heels or doing things in an inappropriate way, that we're on top of that. And we'll bring that to the authorities. Next slide, please. So the first program I want to talk about that was set up in the CARES Act is the Pandemic Unemployment Assistance Program, PUA. And this basically is the program that will capture people that aren't qualified for regular state UI benefits. And I'll get to regular state UI benefits in a minute. But this program will provide them with 39 weeks of benefits retroactive to January 27th through the end of the year. And the benefit levels are modeled after the Disaster Unemployment Assistance Program. And DUA is a program that usually kicks in when there are things like floods and hurricanes and fires and earthquakes. So not all states have experience with DUA, but they're all going to get experience with PUA. Workers will self-certify that they are not eligible for UI, that they are covered under one of the 11 plus justifications for receiving pandemic UA, and that's in the next slide. And broadly speaking, this covers self-employed people, so gig workers, independent contractors, freelancers, people that run their own businesses. People who are seeking only part-time employment, but can't find it, or they do not have sufficient work history or otherwise would not qualify for regular unemployment compensation. It's a very broad definition. It is designed to capture as many people as possible. It does not cover, however, those who can telework with pay or are receiving paid sick or paid leave benefits. And it's really important to sequence paid sick and paid leave first, because we want to do everything possible to keep people attached to the workforce, receiving any benefits, including health insurance they may be receiving through work, keeping people ready to ramp back up into their jobs when all of the stay-at-home orders are lifted, and allowing employers to ramp back up quickly. We don't want to be in a situation where everybody has to go out and look for new jobs or reapply for the jobs that they had and be rehired. Keeping people attached to their workforce is very important. Next slide, please. So these are the covered conditions for people, and applicants need to provide self-certification. They don't need, doctor's notes or anything, that they are partially or fully unemployed and unable and unavailable to work because of one of the following circumstances. And to summarize, it's basically that you've been diagnosed or need to quarantine or self-quarantine, or someone you care for has been diagnosed or has to quarantine or self-quarantine. You're providing care for a kid who can't go to school, or another member of the household who can't go to work because it's closed. You were scheduled to start a job, but now you can't because of COVID. You've become the breadwinner for a household because the head of the household has died as a direct result of COVID. You had to quit your job as a direct result of COVID. Your place of employment is closed, or other criteria established by the Secretary of Labor. And I want to focus on two things here. The first is they had to quit their job as a direct result of COVID. Now, we don't know yet how the Department of Labor is going to interpret this in guidance. We are urging the most broad interpretation possible. I think if there is somebody who certainly is medically compromised and quit their job because they're afraid to go in because of their medical condition, that absolutely qualifies. If there's an otherwise perfectly healthy person who is scared that they might contract this and therefore they quit their job, that might not qualify. There probably have to be further extenuating circumstances. You live with somebody who's medically compromised, for example. Again, we don't know how the Department of Labor is going to interpret it. We want it to be broad, but if you are advising people, generally speaking, people should not quit their jobs just because of generalized fear. There probably should be something more to that they live with medically compromised people, or they have to be in frequent contact with them, or they themselves are medically compromised to be safe. Hopefully when we see DOL guidance, we'll have a better answer for that. The other thing I would note is there is this catch-all. They meet other criteria established by the Secretary of Labor. This gives the Secretary of Labor the power to define more justified criteria for people to receive PUA, which is important both because the Secretary can expand these this list here, but also because it shows that this is meant to be interpreted broadly. Unfortunately, as Pranita discussed, and as I'm sure you've read, there are some ways in which the Department of Labor is interpreting the paid leave and the paid sick leave provisions more narrowly than we think is appropriate, but I think this is a strong signal that the UI stuff is to be interpreted broadly. Next slide, please. So additional programs for people, anybody who is receiving state UI or PUA will get a $600 boost in weekly benefits through the end of July 31st. And it is our interpretation that this will, people will be eligible for it as of this week, the week after the bill was signed. So people will get that benefit retroactive to this week if they were already receiving UI, or if they are eligible for UI or PUA as of this week, once the systems are up and running. There's a hard cutoff of July 31st. There is a non-reduction rule, which means that states can't cut their UI benefits or their duration or certain other eligibility requirements while PUC is up and running. So we don't have to worry about states saying, great, the federal government is going to take care of all of this. You get $1 a week in unemployment benefits now. The next program is PEUC, Pandemic Emergency Unemployment Compensation. This is available through the end of 2020, and it's another 13 weeks of UI benefits for workers who exhaust their state UI. They'll get the same benefit level as the state UI, and if they start in on PEUC before the end of July 31st, then they'll get that extra $600 as well. In terms of sequencing, let me just make it clear to folks, if somebody is eligible for state UI, they will get state UI benefits first, their state maximum, which is 26 weeks in all but 8 states. Then they will get PEUC, those extra 13 weeks. And if they run out of that before the end of 2020, then they will move to PUA until the end of this year. So if there is anybody that is unemployed as of now and would qualify for state UI, they will get benefits through the end of the year unless they find a job before then. If somebody is not eligible for state UI, if they're self-employed or there are other reasons why they're not eligible, they will go right to the PUA program. And there's 39 weeks of that, so they're basically okay through the end of the year as well. And for anybody receiving state UI benefits or PUA, they'll get the $600 extra through July 31st. The final thing to note is that many states have a waiting week before you can collect benefits. If the states waive that waiting week, the feds will pay the full amount of it. Next slide, please. With just a couple of common questions that people ask. Governors do not have to participate in these benefits, but so far we've heard all have. In fact, I'm sure if there was any governor that wasn't going to, we'd have heard about that by now. So people in the states will get this. Unfortunately, undocumented workers are not covered. We fought for that, as did many organizations, and did not succeed, and it's most unfortunate. If people are seasonal workers or didn't earn enough to be eligible for state UI, are they covered? Yes, under PUA. And you can chuckle with me at here, we're seasonable workers. They are seasonal, not seasonable. Many hands in this little webinar presentation here, and I'll have to make a correction to that later. Does everyone get the PUC? Yes, whether you're on partial PUA or state UI or full PUA, you will get the extra $600. We expect it will take workers at least 2 to 3 weeks to see their checks and see this extra $600, but it might be longer depending on how underwater the state is and if there's a complex nature to your claim, like if you've got earnings from multiple states, for example. Again, I have to stress that the states really are, to our knowledge, doing their best to get this up and running as quickly and as correctly as possible. And DOL is supporting in that, in addition to NASWA, which is the umbrella organization of the state workforce agencies. But we do really have to urge a little bit of patience with them. If what we are telling people is if you have just a regular UI claim, if you are an employee, a W-2 employee who has lost your job, go ahead and file for UI now. If you are an independent contractor, self-employed, a freelancer, a gig worker, check your state websites. Don't apply until they say they're up and running, because it's just going to be more work for them now when they should be spending their time getting everything up and running. And we worry that the claim might get lost in the shuffle, even though they say they're going to keep track of everything. It's just better to wait a couple of weeks until things are up and running. Next slide, please. What about people who are not expressly covered by PUA, such as students and parents with children who are about to return to the labor market? We have made the case to DOL that they should cover those folks, but we don't know how they're going to come down on that. If the state pays less than 26 weeks in regular UI, Can you still get the full 39 weeks available? Yes, because after UI is done, the extra 13 weeks will kick in, and then PUA will kick in after that. And we are still encouraging policymakers in states with weak UI programs to increase benefits and expand eligibility, and we're going to continue to advocate for that. It's going to be harder now that the feds have come in with such a good package and haven't attached any strings to it, sometimes like they have in the past, but we're going to keep doing that. And with that, I will end here. Elizabeth, there's one more slide, but it's not one that you need to show. And we'll open this up for questions.
Okay, we have gotten a lot of questions, and so I'm going to try to jump around a little and lift up some of the most common ones. So, starting with about how these benefits count for the traditional programs. So as Panisa said, the paid leave is mostly being paid through employers and really just looks like any other earnings. The unemployment side is a little more complicated. So Judy, do you want to explain what the special rules are for the PUC? I think I get it correct on the
Right.
acronym.
So PUC is specifically not considered earnings or income for purposes of Medicaid or CHIP eligibility. But generally speaking, UI is always considered income because it is income replacement. It's a social insurance program. It's not a quote unquote welfare benefit. So it's usually considered income. So given the very explicit exclusion for Medicaid and CHIP only, we think it is abundantly clear that those are the only two exclusions and it applies to PUC. But the other UI benefits that you would get would be considered income for all purposes, and PUC is considered income for purposes of everything other than CHIP or Medicaid.
Okay, but the thing to note then about that Medicaid exclusion then is that it means that people should not lose their or their children's access to health care because they've gotten this extra $600 a week benefit that depending on what other income the family might have had, that might have been a risk otherwise. So that is important. The challenge of making sure that agencies do this correctly and exclude it where it should be is still a little bit to be determined. Lots of questions about sort of the timing, given that, as you said, states aren't up and running. So let me see if I can summarize the questions we've gotten. The date of application does not determine when the benefits start. It has to do with when people lost their jobs. Is that correct?
Yes, mostly. For PUA, it absolutely will be backdated to the time that you lost your job, with January 27th being the latest date possible. For regular state UI benefits, we are really encouraging people to apply right away because there are states that won't backdate. And like I said, there's this waiting week issue as well. So those people should apply for state UI as soon as possible, and that will be as of the date of application. The PUC benefits will backdate to this week for people who are already receiving UI or who have PUA eligibility that goes back beyond this point. But for state UI benefits that are beneficiaries that are new to the system, it would only backdate to the date of application.
Okay, thank you. So one question, just sort of thinking about, or not a question, I guess I'll just lift this up to everyone, is given the lag in getting benefits, people who, have lost their jobs, who really need support now, should absolutely go ahead and apply for SNAP and possibly for cash assistance if they're eligible for that, and get that started. And then that can be stopped at the point that they get the UC benefits. But there's no reason that people shouldn't go ahead and seek that out while they're waiting, because it could be as much as a month before people start actually getting benefits, is what I'm hearing.
Absolutely.
So I'm looking at these lots of questions. So let me start. Is this being recorded? Yes, it is being recorded, and we will share both the recording and the slides. And we probably will not get to all the questions that I'm seeing, but we will try to either get individualized answers or send you to FAQ questions. That's duplicative, but you know what I mean. So one question, sorry, is... Sorry, it's moving as people ask the questions, so it makes it a little bit hard to read. Um, can you go over just a little bit about what this will look, what self-employed benefits, will self-employed benefits have to pay these benefits back at some point?
No, 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 no. All the PUA, the PUC, and the PEUC, the extra 13 weeks, are all fully paid for by the federal government, period, end of story. People who are self-employed will have no payments to make back at all.
Okay. And another question about self-employed, Punitas. People asked if self-employed workers who file with an ITIN, do we know if they'll be able to access the paid leave tax credit?
We don't know yet because I'm still waiting to look through the IRS guidance. The Department of Labor, the way it usually works is the Department of Labor protects all workers' rights regardless of their documentation status. However, since this program is being funded by the federal reimbursement is coming from the IRS, they have different rules. So we're still waiting to go through that guidance and hope to have more information soon. What we've heard initially is that probably not, but I want to wait to see if that's definitely the case.
So one question is, we all saw the unemployment numbers this morning, and is there a concern that states' unemployment trust funds will run out? And if so, what will happen? Will everyone be transitioned to PUA?
Huge concerns. It will happen for many, many states. In fact, one of the things that we argued for is to try to get PUA to run before state UI to do our best to preserve the state trust funds because we're in recession and it's going to last a while. But the good news is that there's a mechanism in permanent law when the states run out of money, they get a loan from the federal government so they can keep state benefits up and running. So the state UI benefits will not disappear. People don't have to worry about that. There are repayment issues. What happens basically is at a certain period after they take out the loan, they have to start paying it back. And there are employer taxes that they have to levy. And it has historically been the case that as soon as states have to do that, the way that they work to pay it back is to cut benefits instead of raising taxes for as long as they might need to. And the reason they have to raise taxes in the first place is because they didn't collect enough taxes during the good times. It's a vicious cycle that always involves the degradation of state UI benefits. So that's why we are fighting really hard. We fought really hard for it in the third package and lost, but we're going to keep fighting for it in the fourth package and beyond, that there need to be some better federal standards for minimum weeks of UI available. We want it to be a minimum of 26 weeks across the entire country, minimum replacement values for wages, at least 60%, up to 2/3 of the state average wage, and a number of other reforms to really improve recipiency. We want to make sure that states don't underfund programs in the first instance so they can save employers on what are minimal taxes during the good times, and then eviscerate their programs on the back of workers during the bad times because, again, they don't want to do anything to possibly tax their employers.
Okay. So a couple of questions about what's up to state flexibility in terms of whether to count the income. So I think our sense is ordinarily states really can't choose to disregard unemployment insurance for SNAP. We are checking with FNS because certainly Families First also gave FNS quite extraordinary flexibility to waive provisions that because of the circumstances. So for example, face-to-face interviews are being waived, which I'm not sure we ever thought was going to be possible. So we are checking with FNS whether there's any flexibility, but certainly so far we have not heard any. Someone asked about TANF and cash assistance, and that's a great question. As far as I can tell, there is nothing that would prevent a state from choosing to disregard unemployment compensation for TANF purposes. The challenge, of course, is, as any of you who work with TANF know, is that the funding overall is capped. And so you really do want to think about, in this moment of need, where many people, including folks who will not be eligible for unemployment benefits, are likely to be seeking assistance, making sure that you think through all the possibilities before you start advocating for disregarding UI as opposed to something else. Lots of questions about the tax credits and how to get them. So as of yesterday until about, I think, 7 o'clock last night, the IRS was saying everyone had to file tax returns. Yesterday, because they were getting a lot of pushback, they said, oh no, Social Security recipients won't have to submit a tax return. We can figure it out. Some folks asked about SSI recipients. They are definitely eligible. There is not a minimum earned income requirement to get the economic support payments, but at least as of we currently understand it, they will have to file a return, even if they have zero taxable income, in order to get their information in front of the IRS. I would certainly say if you're talking to people, they'll certainly get it faster if they fill out the form, even if we eventually succeed in making IRS doing other kinds of matches. So I would certainly encourage people, if you think about organizations, if you think about state agencies that have contact with people, to support them in filing returns to get these benefits. I will flag that VITA sites are basically closed due to the pandemic. I know there are some places that are figuring out how to provide online support. So we can share information about that. But really the main thing that states can do to help people is provide them information on how to file the return, possibly connect them to people who can talk them through the process if needed. Again, I'm seeing lots of questions, trying to pick the ones that are most commonly asked. Unemployment insurance question about a Christian nonprofit childcare center that laid everyone off that doesn't pay into UI, and whether they will be eligible for the pandemic program.
Yeah, so that is a good one, and there's a couple of tricky hurdles to jump through first. The short answer is yes, people will get something. Organizations like that often can do what we call self-insure. They don't pay into the UI program, but they, when claims are made against them, then they have to pay them back. There are certain states that may exempt religiously affiliated organizations from UI altogether. Not all states do. So if it's a state that exempts them altogether, then that person would get PUA. If it is a state where they would have to pay back the UI benefits that people receive, then people would get UI benefits, and then the organization would be charged. But the CARES Act reimburses 50% of that. So the organization would only have to pay back 50% of the UI benefits that are paid out. So it'll depend on state law, but the workers will either get state UI in the first instance, and the employer will have to reimburse 50% of what's paid out, or they will get PUA.
Okay. Question about sort of 0 hours work, where people, aren't told that they're fired, but they just stop getting any hours.
That's generally called furloughing. I think that most people would use that term. And in some cases, it might actually be good for them because even if they're getting 0 hours, if they're still getting health insurance coverage, which is happening with some workers, that's a good thing. Obviously, there are some low-wage hourly workers that just aren't getting any hours and therefore aren't getting any health insurance. So it's a way to sort of keep somebody attached to the workforce so they can call them right back in when they need them. But those folks would be entitled to get either state UI or PUA. Again, some states would just give you UI in those circumstances, others might not, though the Department of Labor is frowning on that practice these days. So folks should just, if they're at 0 hours, they should go ahead and apply for state UI.
So questions about how you apply for these benefits. Someone asked if you need to apply for the extra $600, or will that just show up automatically?
Automatic.
Okay. And Pranitha, in terms of the paid family leave, so people are supposed to get this from the employers and they may not know that this is newly available. Should they be asking their employers or their employers?
Absolutely. Absolutely. This is our biggest concern, that this is a critical new right that's available, and the Department of Labor is really not doing much to amplify or let people know that they have this right, and should be out there applying, contacting their employer to see if they can get this emergency paid sick days or paid family medical leave based on, the narrow framing for the paid family medical leave, but definitely for the emergency paid sick days. So workers should definitely contact their employers and ask them for this emergency paid sick days and paid leave. And if they find out their employer is not providing this, or if their employer says they won't provide it, they can also follow up by contacting the US Department of Labor, because the Department of Labor is supposed to give compliance assistance to both employers and to employees. So right now, many grassroots organizations, unions, worker centers, other advocacy groups are really trying to ensure that workers know their rights and their rights to these two new programs. Just because the Department of Labor hasn't done a lot of outreach and education. We also want to say that a lot of many states and localities, there's about 22 jurisdictions, 11 states with paid sick days laws, and there are 8 states with paid family medical leave programs. So those are also programs that workers can turn to right now, because many of these programs have also expanded their programs during this health emergency, and are also doing a really good job of trying to get this information out to people so that they have access to these important benefits.
So someone asked if someone's getting partial benefit pay through paid leave, can they apply for partial unemployment insurance?
It seems so. We've got to wait for some guidance to come out to say that conclusively. The other thing I should note, though, is there's a program called work sharing, and this is a formal program administered through state UI agencies. And it's different than paid leave or paid sick, but it is a program where in the states that allow it by law, employers can basically enter into an agreement with their state departments of labor or UI agencies saying, I need to scale back now, but when the stay-at-home orders are lifted or when the economy recovers, I'll be able to rebuild and reopen my business, or not reopen, rebuild and bring my business back to its previous levels. And instead of, firing, for example, 30% of my workforce, I want to do a reduction in work of 30% across the board. And when they do that and their plan is approved, then all the employees will get a 30% reduction in pay, but they can collect 30% of their UI benefit for each week that they have a reduced pay. It's a great program that stops a lot of layoffs and gives employers the ability to ramp back up right again as soon as they can, and keeps people attached to the workforce. And in the CARES Act, there is money for states to implement, improve, and promote work sharing programs. So we hope this is going to be something that is used a lot during this crisis.
Okay, someone
Oh,
asked if the $600 went to people who were getting work sharing benefits.
We don't know yet. That's going to be one of the things that we have to see from DOL guidance. We are certainly arguing that it should.
Sorry, Pranita, were you about to say
I
something?
I just wanted to add one other thing as I'm sorry, it had nothing to do with the UI question. So I just wanted to also say that there's a real opportunity at this time as we're talking about how workers can find out, especially if they have symptoms or they're caring for somebody who has symptoms or has COVID-19 or they themselves have COVID-19. We want to make sure as many people know about this right. And this is a great opportunity for other public agencies to also share this information, even if the Department of Labor is not doing it, to let people know about these rights. So I just wanted to add that.
Yeah, I mean, I think for all of these, really sort of sharing the information and thinking about, if people come in seeking help for one piece of it, really sort of figuring out what's going on with them, and as much as possible connecting them to information about whether it's that, oh, you've never gotten unemployment insurance before, but actually because of this expansion you're now eligible, or hey, actually your employer should have given you paid leave for that, or have you filed your tax return, and really kind of sharing the information back and forth. And even some of the programs that have been around for a long time, people might they might have heard about the new programs but not know about SNAP or how to apply for that. So just as much as possible as we can share the information, even if the systems unfortunately are not talking behind the scenes with each other. So I'm looking, I know we're running out of time and we are getting lots and lots of questions. We'll try to share as many of them with our speakers afterwards and get back to people with the answers later. Some questions about direct deposit and to make sure that the IRS has the right information if you used a third party in the past and your refund went to them rather than directly to you. If that was the case for 2018, the simplest thing to do is just get your 2019 return in with good direct deposit information. Someone asked about if you had it deposited onto a cash card, say in 2018, and you no longer have that card. In theory, if those cards are invalid, it'll get bounced and then the IRS will issue a check, or if it's to a bank account that's been closed. But if it's just something that you don't have access to, again, I think logging on when they have the new portal up and updating the information is probably a good idea, because I do worry about the money kind of disappearing into bank limbo. I will recognize that many folks with low incomes do not always have access to bank. So that's, again, another thing that nonprofits can, or state agencies, city agencies can help people with, is connecting to low-cost bank accounts so that they can get these funds. Question about higher education student emergency grants and how they will interact. And I think the answer to that is we do not know yet. It's a great question. A significant portion of the higher education funding that's flowing through schools is supposed to support students directly. And I just don't think we know what that will look like, or what will be countable income. In general, the benefit programs don't make you report kind of one-time payments very much as ongoing resources, but we'll need to look at that closely. Someone also asked about, a restaurant employee relief fund, and does that need to count to income? Typically, a one-time payment would not need to be counted. Ongoing payments would be, but I am not a lawyer. I am not providing individualized advice. So I think it's really important to check. Yeah, and certainly, Someone asked, is the $1,200 in benefits subject to state income tax? No, it is a tax rebate. Like the EITC, states cannot tax that. If your employment was as college work study, are you eligible for any of the benefits? I do think one of the PUA, if people are in like service learning core or work study, things that might not have been covered under state UI, they might be eligible. Judy, do you know the answer on that?
We don't know. They might be, and that is another one of the things that we've encouraged DOL to include. So we'll see what they do.
Okay, so as I said, this is definitely still a moving target. As we get more information, we will certainly share it with more. Someone asked about the timing of the rebates. If they file immediately, when will payments be received? The IRS says they'll start making payments in a few weeks for the people who've already filed 2019 returns. The overall filing deadline, if you have to file federal returns, has been extended to July 15th. If you otherwise would not have to file a return, but are only doing it in order to get the rebate, my understanding is that you can do it any time this calendar year. If you haven't done it by 2021, it will become a credit that shows up on your 2020 tax return when you file that in 2021. So there is some time, but obviously people really need the help as soon as possible. So getting the information out quickly is helpful. Pranitha, Judy, any last comments that you really want to make? And then we'll wrap it up since we're at the hour.
I would just note that NELP will be continuously updating our materials as we get more guidance. If you go to nelp.org, it'll immediately prompt you to go to our special page on coronavirus resources for workers. And all of this stuff about unemployment insurance and anything else that we're working on and any of other resources we can find will be up there.
This is Pranitha. I just want to say the same thing. We're just updating all our information on the CLASP website. We have a COVID-19 spot on the CLASP website, and we'll continue to share updates, including updated guidance from the Department of Labor and some frequently asked questions sheets and documents with folks. And Paid Leave for All, which is a different campaign that we all belong to, is also hosting a set of webinars over the next few weeks to help state and local agencies and advocates learn more about the intersection between the state paid sick days and paid leave programs and this emergency paid family medical leave and emergency paid sick days programs. So thank you.
So really, thank you all for joining us, as well as Judy and Pranitha for your time. As I know we did not get to all of your questions, but I really appreciate getting them. I know we'll all use them to make sure that we're getting the answers and including them in our materials. We realize it's a confusing and challenging moment for everyone, and thank you for all the work that you do to support workers who have been earning low incomes, who have lost their jobs, and who are going through hard times right now. So thank you.